Hello everyone, dear friends. We welcome you to our channel, our medical channel. Once again, let me repeat, we make videos about manual therapy, specifically the techniques, and we conduct diagnostics before and after manipulation. Everything else is about therapeutic exercise and physiotherapy. I think we'll just include it in sections. It's not super interesting, but physical therapy, yes, it's very informative and interesting and very necessary for each of us. It will be a little later, but we will definitely connect it. So today a patient came to us by, what is her name?
Love.
Love. What a truly beautiful name indeed. So what brings you here today?
Actually, I probably have a whole bunch of things that are bothering me. The first thing I've been constantly struggling with, probably since high school, from the upper grades, is that my neck hurts in a weird way. Sometimes it lets up, but sometimes I can't even turn my head. I always ask my friend to give me a massage, but it's constant. And then, for the past 3 years, my lower back has started to ache. I don't know, maybe it's because I have some kind of arch in my back, or maybe it's the way I walk, but sometimes it gets really painful, right here in this spot. I don't know if it's possible to strengthen it or not. I also often get strains in my legs. I'll put my leg a certain way and then ouch. And up to 3 times, but in the past year, I twisted my ankle 3 times. Then for 2 weeks, you're hobbling around.
So when you twisted your ankle, what did you do?
When I twisted it, we were just walking in the park. There was some little step or something, I don't know, maybe I didn't notice it. And apparently my foot landed wrong, and then...
Yeah, I see, got it. And then what did you do next? Well, the pain, does it go away in a day or?
No, it takes me about 10 days. For a week, I'm hopping around on one leg. So like when moving around the house, but I don't go outside.
But you don't use crutches?
No.
Just hobbling?
I don't leave the house because I can barely walk, and then it recovers. It takes up to about a month. There's still some pain left. So you can walk, but if you say walk a lot or put weight on it, you can feel it.
So you don't put anything on it?
Of course I do.
What do you use?
Diclofenac, heparin ointment, and something else I don't remember. So something for the first 2 to 3 days, and then ointment after that. My mom remembers the ointments better than I do. She reminds me every time. I keep them in the fridge. Art often wants to. You know, the classic ones.
Do you wear anything?
Well, an elastic bandage.
Elastic?
Yes.
You do it yourself?
Yes.
You wrap it yourself? Well,
I've learned how to do it by now.
I learned after 3 times too. All right, good. Well, what does this tell us? To get ahead of ourselves a bit, it means you need to strengthen your leg muscles. There are a number of specific exercises, not just for the foot, but for the shin, the peroneal area, basically for that whole section. No, I'm not talking about just that. I mean all the lower limbs. We'll take a look at that, then I'll show the patient and explain what to do about it.
That's not all, I have more.
Go ahead.
Also, probably about 3 years ago, I was doing some renovations at home and I needed to patch up the ceiling. And apparently I was already tired and my arm started to hurt really badly. They put a cast on me. I wore it for a while, but it didn't help at all. Later it turned out that I had nerve damage. So for about half a year, I really couldn't, well, I couldn't write, couldn't do anything, nothing at all.
I thought you were going to say you couldn't stir things.
No, I just couldn't. It was too painful. I mean, it just wouldn't work at all. Then it recovered after about half a year, but if I put any kind of strain on it, like carrying a heavy bag or something, I still feel some pain remains. Or for example, if I make a certain movement like scrubbing or cleaning something for a long time, the pain comes back now and then.
That might actually be coming from your neck. You were working in a static position and your arm was raised up, if I understood correctly.
Yes, for about half an hour.
Did you have a cast, a splint, or something else?
The doctor just looked at it and made a decision. Maybe we managed to avoid a fracture, or maybe it was something else. They didn't figure it out, put a cast on, and then referred her to a neurologist, since she just bent
her hair. I just want to say for the first time that here, most likely they might not Put a cast on rather than put one on just in case.
That's how it turned out for me.
That's an interesting approach, but the main thing is that everything moves.
And there's something else I wanted to say. I've been practicing yoga for many years, though with breaks due to health, childbirth, and things like that. And once it happened that I was being stretched, when I was doing the splits, the kids pulled me too hard. And this part here, it hurt too, so I couldn't do yoga for about 6 to 8 months. So any kind of stretching for 6 to 8 months. Yes, stretching these muscles was painful for me. Now that's gone, but there are times, for example, if you do something, there's this one spot right here that shoots with pain, or when there's some kind of strain, like if you stand for a long time at an event or something, you also feel it as if the backside starts to ache.
Well, ideally, of course, you really should get an MRI done. That is, an MRI gives answers to all the questions, and you should do all 3 sections. That means the cervical, thoracic, and lumbar regions. If there's nothing, no pathology, that's good. But at least we'll know there's no pathology, so we need to look for something else somewhere else. Here, if you lean toward the idea that stretching was to blame in this case, then you might have caused an injury. An injury can be of various types, from mild severity to severe, and of course moderate somewhere in between. But any injury should be followed by a proper rehabilitation process for recovery. So rehabilitation is necessary in any case. So what do we have? We have discomfort in the cervical and lumbar regions. From time to time, so to speak, our foot leaves the chat and there's some minor discomfort. We also have discomfort along the back of the leg.
Yes.
Anything else?
No.
In principle, we're ready to proceed with the examination. By the way, I want to wish you a happy upcoming new year. It's already just a moment. December 26th, 27th, and 28th. We'll probably record some separate greetings as well, but there won't be many. Exactly. So, to each of you individually, I want to wish, first and foremost, good health. It's hard to buy. I'd even say sometimes it's impossible. So we wish great health to your loved ones and family, sisters, brothers, mom, dad, grandpa, grandma, great-grandma, and all your relatives. And especially to our future generation, our children. They are the most precious thing we have. So first and foremost, health to them. Take care of them, watch over them. For example, regarding scoliosis, I even have a patient who treated himself, and now he has brought his child to me. The child has 3rd-degree scoliosis. How did they miss it? Well, they went to the sea recently and noticed it there. In general, they have a huge task ahead of them. It's hard work, first and foremost for the child himself. So watch your children, take care of them. So, Happy New Year in advance. Hugs to everyone. And now let's move on to the examination. We're about to do laser diagnostics. We'll examine the patient using the laser by level. Then we'll measure her height and move to the examination couch. There we'll be testing massage in neurotherapy. So it should be interesting. So, dear viewers, we are ready to move on to our laser diagnostics. However, since YouTube doesn't allow us to post our full videos, you need to scan the QR code to go to Boosty, where you can watch our complete videos, uncensored. So see you there. Well then. Love, asked for the maximum. To do it exactly like in the old Soviet times, which was quite tough, wouldn't you agree?
Yes.
All right then, I will quickly proceed to retrieve a clean, soft towel. The goal is maximum relaxation. Is that right? Everything's good?
Yes.
Relaxed. The lower back stretched well. Something's clicking. Breathe in deeply, inhale slowly, and exhale gently. For us there, when counting, it's for the height. All right. Once again, we mobilize the joint. Well, let's do it on the other side too. Symmetrically. Inhale, exhale. Good. Wonderful. Turn over. On your side. Which one do you like more? Well, let's turn to both then. Relax. Other side. Relaxed. Good, let's sit up a little now. Get energized. Intense, and we haven't even gotten to the neck yet.
Some kind of noise or something like that in my head.
Hands locked behind the head. Round your spine just a little lower. Show me. We're doing this kind of test. It also exists from the back, from the back, from the back. Now from this side, you can already see that it's become more or less symmetrical. Go ahead, please. I'm afraid now. With me. Now gently lower your head down. Close in, elbows, pull them inward, head back. Yes, come on, more, as much as you can, as much as you can. Weak. Very weak.
How did it go?
I got it. All right, the neck. Feel like you're truly in a Maybach. Just lean back and relax. Give me your neck, just like that. Right there, please. Stop. Just relax. That wasn't enough. What just happened? You are praise it more and more. You heard a dull sound. Relax, don't worry. I don't know if it will be audible or not, but both the patient and I definitely heard it. Someone is cracking above us. Let your arms go gently, bend forward slowly, and relax completely. You know, every single crack, every distinct pop, it truly carries its very own unique and specific information. So what just happened? Well, it's been in such a restricted joint for a long time, that's why it sounds like that. If when I'm working with a patient, like just now, this happens, I was pushing the first rib and mobilizing the neck, and there was this dull sound. That means it's not fully worked out yet, and there's still a lot to do with it. Also, when you're working with individual patients who are experiencing significant joint problems, here too there can be dull clicks, sometimes so quiet that you might not even hear them yourself. Let's lie down on your stomach.
So when it's the clear sound, is that better?
It's hard to say clear here because right now it's also clear sounding. No, we'll leave that as is. But it just sounds a certain way on its own. I don't know, it comes with experience, with practice, I guess. Arms along the body, head on the chin. Well, they vary. It's fine here. Well, what do you mean by fine? There's no strict standard, but there is some mobility. Let's turn over. So tell me, are you feeling completely relaxed and at ease now? Trust me completely, just as you have always said, I trust you implicitly. So please trust me in return. Give me more. Wonderful.
The last one was the most painful.
And where did it hurt?
Right here, and it radiated back here to the shoulder blade.
Now you're starting to feel some lightness. Just rest your head.
It started to appear after you did everything before, but right now I still feel this lingering pain.
It will start to subside now.
Feeling has been there for the last few minutes. For about 5 minutes, it feels like either everything is floating or there's some kind of movement going on in my head.
Do you want to float away?
Not exactly float away, but it's somehow different. So it's like you live your life one way and then suddenly it changes like this.
Well, we, like engineers are now, you see, reassembling you. Official dealers.
Well, everything seems to be burning up, in my opinion.
So, shall we continue? We have facet joints, elbows together. Elbows, elbows, these aren't elbows. Yes, that's right, you see, completely. And your arms, how are they comfortable for you? So after decompression, you need to, so to speak, just a little bit, put them back in place. I've said many times that the male pelvis is different from the female pelvis because of, to express, to distinguish, at least for someone, this is, but no. I mean, someone really has to do it, after all. And not just that someone might need it at all. I put the stress on the wrong syllable, my bad. Here it's fine. We'll go a bit higher on the price. We're already short there, right? By how much? A whole centimeter. Anton, my friend, tell me, what's exactly going on with you? It's good, that's it. Would you be upset if you were missing a whole centimeter somewhere? Upset? Anton would be upset. Relaxed. So now we're going to move on to the control test. Anyone who is interested in seeing precisely how we meticulously conduct the control test can go and see. What was that square thing called? The one you point your phone at?
By QR code.
That's right, by QR code. So just point your phone, you'll be redirected, and you'll have the full video. That's it. Love. A few words.
Right now, I feel just like I said earlier, it's all in my head. Everything feels like it's floating, my whole body is burning in my neck. I just want to lie down, stay still and not move. That's the state I'm in. I probably haven't fully realized everything that's happening yet. I just feel like something is happening, some kind of process, some kind of transformation, But what makes me happy is that, for example, I can stand here, move like this, and my lower back doesn't hurt like it used to, constantly and without stopping. And like we just did in the test, when I turned my head to the sides, I could turn it much farther than before. It actually feels like I can turn almost 180 degrees. And I got 1.5 centimeters taller.
Which is the most important thing. Well, you're standing like a ballerina now. Well, what can I say? Your session is finished for today. I explained why this happens and what needs to be done. Usually patients go home, lie down, and sleep for a long time. That's a normal reaction. Blood flow increases. Naturally, nutrition increases, and this is a slight shock for the body. Due to the fact that the body is accustomed to limited things. And here the restrictions, so to speak, the sanctions have been lifted. There is one point. They have been temporarily removed due to the need to engage in therapeutic exercise. We can't go anywhere without her. Well, at least you're pumped up for today. You're welcome. We say goodbye to you for today. There's more interesting stuff ahead. Once again, happy upcoming holidays, and may peace and health reign above all. Everything else we'll find. So thank you all for watching. See you next time. Bye.
Happy New Year.